All right, we're live.
Okay. On behalf of the Guild of St John of Jerusalem Eye Hospital, I'd like to thank you all for joining us today. This is our second online event, and we are thrilled to welcome Ahmed Mali, our Chief Executive Officer of the Eye Hospital Group, who has kindly agreed to give a presentation on the impact of COVID-19 on the provision of our eye care services and how he is managing the response to the crisis. I'd like to introduce Diana Safier, our Guild Coordinator, who's worked really hard to make this event a success. Thank you, Diana. After Ahmed's presentation, Diana will host a Q&A session, giving you the chance to ask questions via the chat button, which you'll find at the bottom of your screen. We also have some questions in advance when registrations were made. The Guild is a volunteer group of eye hospital supporters in existence for almost 100 years. We can trace our roots back to a time in the early 20th century when the group in Jerusalem provided linen, often embroidered with the St. John emblem, and distributed to the hospital wards. Over the last century, it's become an effective fundraising group, continuing to raise awareness and funds for our hospital in Jerusalem, our mobile outreach programme, and more recently, our hospital in Gaza and clinics in Hebron and Anabta. In 2020, the Guild's commitment is to support the funding of the mobile outreach programme, where we take eye care provision to patients who are unable to travel. It's an essential service in the region. Our apologies if there are any IT issues during this afternoon's talk. A recording will be available afterwards, so do please make contact if you'd like to receive a link. Thank you again for joining us today, and we hope you enjoy the talk. I'd like to hand you over to Ahmed now.
Thank you, Georgie. And can you hear me?
Yep.
Yes, you can. Well, thank you, Georgie, very much indeed for organizing this evening. And of course, I would like to thank Diana Safier for dealing with all the logistics. It's always my pleasure to speak to our supporters, especially the Guild, who have been the supporters of the hospital for so many years. And I thought to start with, for those who are not very familiar with the eye hospital, that I would like to share with you a presentation showing some of the work that we do before I talk about specifically about COVID-19 response as a global crisis affecting the whole world, but also the hospital as well. Again, for those who have not met me or haven't seen them or have not met them, I would like to say proudly, I have been part of this fantastic hospital and order for the last 30 years. I joined the hospital as a student nurse and then stayed with the hospital, and I've done all my studies thanks to support from the hospital. So I feel this is the time for me to give back to the hospital. I was privileged and honored to be the first local homegrown CEO of the eye hospital, officially appointed almost 1 year ago now. So if I may, I would like to give you a bit of a background to the context within which we function in Jerusalem. The group, as you see, we are no longer St. John of Jerusalem Eye Hospital, but we have added the word group because we started in Jerusalem in 1882 in East Jerusalem as the first eye hospital to be in the Middle East. But then we also, due to various restrictions of movement on staff and patients, and of course the increased demand for eye services, we also moved and opened our services in the West Bank. So our Hebron Hospital was established in 2005. It's a day hospital and provides some surgical procedures, but mainly primary, secondary, and some tertiary eye care as well. Anapta Clinic, actually it's a center, was established in 2007, provides mainly pediatric services, pediatric ophthalmic services, and also primary and secondary eye care, especially to diabetic patients with eye diseases. The Old City of Jerusalem Muristan Clinic, as some of you know very well, the Muristan site is where the Order of St. John was established or started more than 900 years ago. We renovated the site as a Garden of Peace, but also established a small primary care clinic in 2016 to provide care to our people in the Old City. The Gaza Hospital, actually we started in Gaza in 1992 as a small clinic and a small center. But in 2016, we built our own day hospital in the Gaza city. Now it provides almost all medical and surgical ophthalmic services. And good that we have done this, because in the last 6 months or so, we have not been able to receive any patient from Gaza due to various political, security, and of course, COVID-19 factors. The mobile outreach was established in clinic was established in 1980. We used to do outreach services in Gaza, but now we only focus in the West Bank. And again, I must thank the Guild for supporting the work of the outreach services that we are carrying out at the moment. The services we provide, our aim is really to save sight and change the lives of the most disadvantaged people in the Holy Land. If I may, I would like to mention some of our achievements in 2019. And I hope in 2020 we'll meet at the end of the year and I'll be able to show some achievements, similar achievements as well. So in 2019, we treated close to 140,000 patients. 38,000 of those were children. We performed close to 6,000 major operations. And we opened also a second operating room in the Gaza hospital, which enabled us to increase our surgical uptake, if you like, in Gaza by almost 50%. It's worth mentioning that almost 1,900 surgeries were performed in Gaza last year. Without having this hospital there, I think at least 2/3 of those wouldn't have received this care, because otherwise they needed to negotiate access to Jerusalem. And most of the time, this is quite difficult for many reasons, let alone security and the permit process reasons. I would briefly like to mention our strategic plan. We have 5 strategic aims that we would like to achieve in the next 3 years, 2020-2022. Our main focus will always remain patient-centered services, putting our work focusing it mainly on the most disadvantaged and marginalized people in the Holy Land. We are a JCI, which is a Joint Commission International accredited hospital. We were the first eye hospital, or the first hospital in East Jerusalem to receive this American accreditation for quality. And for us, it is a sign, or not a sign, but it's a confirmation of a quality service that we provide to our patients. Now, the second aim or strategic aim that we would like to achieve is that we will continue to look after our staff and care for them, and of course ensure that we employ those who care for our people as well. And investing in people has always been a prime objective of the Order of St. John and the St. John of Jerusalem Eye Hospital. And I think I'm a living example of that. As I said in my introduction, I joined the hospital in 1990 as a student nurse, and then I was seconded by the hospital to travel to England for 3-4 years, come back again, went back to England. I spent about 6 years of my life in the United Kingdom, in various hospitals and universities, and all of this was fully sponsored by the St. John of Jerusalem Eye Hospital, and therefore it is our aim and our objective that we care for our people and build their capacity. Another thing, that when I joined the hospital in 1990, almost all senior staff, whether medical or nursing or some administration, were, with all respect, expatriates. And then there was a vision to invest in people of the hospital, the local people, and I think we have reached a stage where by now we are very proud to say that we are, all the staff are very well trained and capable, and I hope that, and I am confident that the hospital is now in safe hands, as it was before when we had the expatriate senior staff at the hospital. The third objective or aim, if you like, is the sustainability of the hospital. This is the one I'm a bit worried about, I must say, because this strategic plan was mainly, I mean, there was the work of the board and myself, but we rely almost 50% on our budget and running cost on patient income, or the income that comes from the patients or from their insurers, whether they are Israeli insurers or Ministry of Health or Palestinian. Almost 20% we rely on funding that comes to us from our supporters at the priories, including the English Priory, of course, and the Scottish Priory and the American Priory. And I don't want to mention all the priories because I might miss one and then I'll be in trouble. And the third source of income for the hospital is the voluntary income. And I think it's fair to say these are, especially this year with COVID-19, this is the objective or the aim that I am not 100% confident that we will be able to achieve it to the level that we have hoped for. Governance and partnership, of course, we have a strong governance system and strong leadership in the hospital, and this is something that we would like to strengthen more and ensure that we have we work with donors, whether they are, I mean, we work with donors and partners, whether they are Israeli partners, Palestinian partners, people from Morpheus Eye Hospital, all over the world. We are open to partnership with all those who share our ethos of caring for people, regardless of their race or ability to pay. The last strategic objective for the next 3 years focuses on education, research, and innovation. I think it's fair to say that in the last 38 years, we have been mainly focusing on services. I think we have reached a stage whereby we have become a service of an excellent center for ophthalmic services. Our doctors and our nurses and all our staff are the leaders in ophthalmic services, the providers of ophthalmic services in the country, and our patients are extremely satisfied with the service they receive at the hospital, and of course, being a quality hospital as well has added to that. Now, something else we need to focus on more is research and education. We are, of course, we train doctors and nurses. I think we would like to take this even further, and we would like to strengthen the academia, if you like, of the hospital and bring the hospital to that level of innovation and research that is going to be recognized in within the ophthalmic academic community. Now, if I may like to come to the COVID-19 pandemic, as we all know, the World Health Organization declared this is a global world pandemic in, I think on the 6th of March this year. And there isn't a country, I mean, I'm not very well informed there, but I'm not aware of any country in the world that has not had some kind of an involvement of COVID-19. But bringing the situation locally in Israel, the first COVID-19 case was discovered on the 22nd of February. In Palestine, or the Palestinian territory, if you like, on the 6th of March. I mean, both authorities, the Israeli authorities and the Palestinian, worked together and enforced severe lockdown measures. I mean, I think the Palestinian Authority took things further and they were very strict on movement. People were not allowed to move and there were places under curfews. This lasted for about 8 to 9 weeks and people observed that very well. And as a result of that, we had very few cases of COVID-19 in Palestinian territories. Again, Israel did very well as well. I think there were only the number of fatalities were low until mid-May, when all these restrictions were eased gradually, and this, of course, has resulted in other sort of second wave, if you like. As I said, I have been at the hospital for 30 years, but I think this has been the most challenging time for the management of the hospital, for the staff of the hospital, and I think it is right to say this has been also difficult for the whole world. I'm aware that eye hospitals around the world in Israel and in England also suffered because of that. There was a reduction in the number of patients who are able to reach the hospital. And also sometimes people will delay eye care because they're worried about traveling and using public transportation. Again, this has affected the income of the hospital because we rely on almost 52 to 53% of our budget. It comes from that what we get from the patients or from their insurers, as I said, whether they are private insurers or Palestinian or Israeli. During the closure, if you like, we lost almost 70% of our clinical activities in Jerusalem. Some of our staff were not able to reach the hospital, not only from the West Bank. Some of the staff in Jerusalem were not able to reach the hospital. There were some neighborhoods under complete lockdown, and some people actually prefer to stay at home. We liaised with the Israeli authorities and the Palestinians and to ensure that patients who required emergency major surgery, that we were able to come to the hospital. During the lockdown, again, in the West Bank, the reduction in clinical activities was a bit less because people were able to reach the hospital or the centers, if you like, in Hebron and in Anabta with easier than coming to Jerusalem and negotiating checkpoints, etc. So there was about 20 to 30% reduction in the overall clinical activities. We are talking specifically about April and May, first week of May as well. Gaza, actually, Gaza is a bit of a phenomenon, if you like, in Gaza, whereby I think so far there are about 17 cases only of COVID-19. I'm aware that almost all, if not all, were people who traveled cross Rafah crossing from Egypt. And of course, the de facto government there is taking this very seriously. And I hope that this will continue. The situation will remain as is in Gaza with no further cases, because the healthcare system in Gaza is really poor. And as a result of that, of the low number of cases, we continue to provide services almost as normal, with a slight, we actually decided to reduce the number of patients in order to ensure that, patients were, social distancing measures were observed at all times. As I said, we worked closely with both authorities, the Israelis and Palestinians. We have to do that in order to ensure that our work, we work smoothly and our patients are able to reach the hospital. We were the only provider of eye care. I mean, this is not an exaggeration. All private doctors, eye doctors, and even the small facilities for the Palestinian Ministry of Health were stopped, and we remained the only referral or eye care provider for the whole of the Palestinian territory. And therefore, it was important for us to continue to provide 24/7 emergency eye care. As a result of that, in the 8 or 9 weeks of lockdown, we performed in both Jerusalem, it says here in Jerusalem, but I think it's both Jerusalem and Hebron, we performed close to 200 major surgeries. We at the hospital, from day one, we followed strict guidelines of safety for patients and staff. We followed guidelines from the WHO, from the local guidelines. We ensured that not all our staff stayed at the hospital at the same time. So we had a group of doctors staying at the hospital, mainly the residents, for 14 days before we discharged them, if you like, and then another group of doctors, just in case there will be a case of COVID-19, and then therefore we could maintain the services and not put everybody in isolation. Again, it was very important for us to decide on a category of patients that they are urgent cases of patients. We have done that with support from our head of governance, Dr. David Varetti, the hospitaler, and we agreed on a list of patients that we must see, and we have done that as well. Strict guidelines to manage staff sickness. Anybody who had a runny nose or had temperature or flu-like symptoms were prevented from entering the hospital, even if they are staff or patients. They were asked not to report to work and go and seek medical care or stay at home at least. Unfortunately, we had to stop our outreach services because of social distancing and going to communities, and these we were not under our control to ensure that people observe that. And all non-urgent clinical activities in the West Bank and actually in Israel as well were prohibited. Nobody was allowed to work unless it's an emergency kind of a situation. And but what we did during that period, we continued to provide outreach service to Jerusalemites who live outside the separation wall, and basically we rented a clinic outside the wall, and then we had control on what takes place there, and we were able to ensure safety of staff and patients. This, of course, resulted in a loss of services to patients who need this most, especially those in remote and marginalized areas. It was crazy, actually, at the beginning of the crisis and the lockdown. We were not able to, we had enough supplies to last us for a month or two, but with the whole panic, we wanted to get supplies for 6 months because mainly personal protective equipment, masks and gowns, etc. And so we were trying to get more these fancy masks, N95 and all of that. We were not able to do that. But at some stage, actually, we made our own surgical mask at the hospital. That shows really we were not really very busy, but we managed, and maybe a month later, the prices even of all protective gear came down, and we stocked our stores for at least 6 months to come. So to start with, it was a bit of a panic, but then we worked with other East Jerusalem hospital, and we've managed to do that really well. This is the slightly, if you like, detailed part of the presentation. I will not spend too much time on this, but this pie chart, if you look at the left side, is our budget for 2020, which is approved by the board in December of last year and January of this year. So this is the first time ever that we presented to the board. They thought that I was courageous to do that, presented a balanced budget. So we went and said, we are not going to have a deficit this year by the end of the year, and this is how we're going to do it. So we needed 12.9 million, and this is not an exaggeration. It's nothing to do with me. It's the team. It's everybody who works at the hospital, the doctors, the nurses, and everybody. Until March, we were on target. we were on target. I promise you that we were on target. Now, things have changed, of course, because of COVID-19. So, for example, if I take patient income, we were looking at 45% of our budget to come from patients, but because of COVID-19, now we are looking, as a result of that, at less than that. I think I cannot say it here, I think it's about 20, yes, 26%. And so all of this really presented a big challenge for me, and the group, of course, and the board. How are we going to manage this year if we are thinking that our deficit is going to be 4.3 million pounds? Only 3 months ago, or 4 months ago, before that, we thought that we're going to have a 0-0 budget, basically a balanced budget. So again, all of this is because of the COVID-19, and then we had to think, all of us, local management and board, to think outside the box and deal with the crisis. So based on this financial, the first quarter of the year, we presented to the board 3 scenarios. The most favorable, least favorable, and the extreme scenario. And then the board, with the senior management team, decided what scenario is most likely to take place, if you like. So as a result of that, it was expected a deficit, we expected a deficit of 4.3 million pounds. So we decided on 4 major steps that we have to take. First of all, increase our voluntary income, reduce costs and enhance efficiency in all departments in the whole group. Unfortunately, we had to reduce or think about reducing payroll costs. And then the priorities, we thought we would like to lobby the priorities, ensure that there will be no drop, major drop in their contribution than the year before. So we decided to speak to the priorities and hope that we will be able to receive more or less the same amount as we did last year. So this is what we did. We reduced payroll costs in April and May by more than £500,000. We launched an emergency bill, local emergency bill. We managed to receive close to $500,000. We plan to reduce our payroll cost if the situation continues as is in September by another £250,000. We have already reduced our variable cost by 70%. We have launched an early recovery COVID-19 appeal, hoping to receive close to $500,000. And again, with our work with the priorities, and we still hope that the priorities will give us close to what they did give us last year. And if we do all of that, then there will be a deficit of about 1.6 million pounds at the end of the year. So the pie chart really just translates all of this into numbers. As I said, we have launched a second appeal, basically both in Jerusalem and in London, and we are aiming for $3 million. This is going to be an 8-month kind of campaign. We are working closely with the Palestinian Ministry of Health and also the local representative of the WHO. We expect about 80,000 patients. This backlog of patients, about 80,000 patients who have not received eye care during the lockdown, especially that the Palestinian Authority have closed down all their ophthalmic units. And last week, or I think about 10 days ago, I had a meeting with the Palestinian Minister of Health, and she has given us all her support that she would support any such initiative whereby we raise the funds and we look after their own patients, the Palestinian Ministry of Health patients who have not been able to receive eye care because of the COVID-19 situation and because of the poor financial situation the ministry is in, or the whole actually Palestinian Authority is in. I would like to conclude by saying that this is a very kind of strange situation we are in. We are uncertain of a second wave, and I would like actually to say it's likely that we are in a second wave now, especially in the Hebron area. We have a large number of cases, I think close to 200 a day for the last 3 days. This is, in my eyes, a second wave. We never had this amount or these numbers in the past, in the previous April-May scenario. So I think we are now entering a second wave. The same in Israel as well. I think yesterday in Israel were about 780 something, more than what they experienced in the whole month of May. Of course, under these circumstances, we will continue to enhance our services and the efficiency of our services and reduce cost wherever possible at the whole group. We need to remain vigilant and proactive. We need to keep our patients safe. We need to keep our staff safe. And I must say that so far, we have not had any incidents of cross-infection. Unfortunately, other hospitals in East Jerusalem had some cases of COVID-19 amongst their staff and their patients, despite the fact they were not dealing with COVID-19 patients. So we need to remain vigilant. And this is something that we insist on daily basis. We have meetings to ensure that everybody, every patient, every staff who comes to the hospital goes through one gate, if you like, and their temperature is taken, and ensuring that everybody wears a mask. And if they don't wear a mask, or they don't have a mask, we give them a mask. And so basically we need to do that. And I hope that we'll continue to have a zero number of cases in the hospital, whether it's amongst our staff or patients. And it's very important for us to keep working and informing our partners and supporters worldwide, especially the priorities, the American priority, the English priority, the Australian priority, everybody, the Scottish priority. So all the priorities are aware of our situation, aware of the services that we provide. And there is a hospitaler and the chairman update that comes out regularly. And of course, there's also a CEO update that aims to give a picture or clear picture of the situation in the Holy Land. I think that concludes my presentation, and thank you very much indeed. So over to you, Diana.
Hi, Ahmed. Thank you so much. That was absolutely amazing.
Thank you.
If you don't mind stopping the share. Yep, perfect, great. So thank you for that. That was so interesting. I've been monitoring all the comments that have come through on the chat. Firstly, I just want to say that the recording, this is being recorded, and we are going to be sharing it on the Guild mailing list within the next few days. So some people have asked whether they will, whether they can have access to that. So we'll be sending that out. So you'll be able to use that, share that widely, please, because we would love for this to go far and wide. I just want to thank everyone who's joined us. We've got people, Ahmed, here from the priories all over. We've got Canadians, people from New Zealand. We've got a bunch of people. We've got Carlo and by proxy, Vanessa Redgrave, Carlo Nero and Vanessa Redgrave, who did our last event. Some of the people here would have come to that, where we screened the film that we made in 2015. Yeah. Carlo directed it, Vanessa helped produce it, and it was, as you remember, so good for sharing our work. So I think Carlo's about to send a question from her. But in the meantime, I've got some people offering. Niall Johnston from the KT is saying that he'll share it, the video of this. So that's super exciting. So it's really nice to see that there's going to be some traction from this. I also just want to particularly mention that we've got Paul Herbage here. He's the new St. John, the Prior of England Hospitaller. So that's super exciting. He's been involved with us and helping us for so long, obviously. So it's really nice that he's got this capacity. And also David Verity, you mentioned him. He's here as well as a bunch of other trustees, guild members, staff, volunteers, etc. So it's just been a really lovely group of people. I personally have liked catching up with everyone.
Thank you.
I've been posting the mailing list link in the chat box. So if you want to register for upcoming guild events, we've got quite a few coming up that we're really excited about. So please do that. So the question I would like to ask is from George Woods. He's from St. John, South Africa. He came to Guild Hall, our Guild Hall dinner a couple of years ago, 2018, with Queen Noor and obviously CEO Ahmed Mali. He says, alternative sources of income for priories is found within the core business of training first aid and basic life support. Priories have now gone digital first aid, and this will provide much needed additional income. Would it be feasible to set up a training body within the hospital and capitalize on the body of knowledge resident within St. John? So have we looked at doing anything online?
Answer the question. Okay. Well, actually, this question came up at the last Ground Council meeting, whether St. John can benefit from or generate income from conducting first aid training in Jerusalem. It is a bit of political situation whereby here we can provide first aid to the staff. I mean, we do provide first aid training to the staff here and to the consulates, for example, and we do get paid for that, especially to the British consulate. Now, in the West Bank, this is done only by the Palestinian Red Crescent, and nobody else can do that. I think there is a way that we can do that, but I don't think this will be a major source of income. As I said, I remember I have done that personally myself when I was director of nursing. I've done training for some of the consulates, but in Israel, all of this is done through Magen David Adom, which is the Israeli ambulance service, and in the West Bank is done, and Gaza is done by the Palestinian Red Crescent as the official ambulance and first aid providers for the country. I mean, the idea is absolutely, I will take it on board. I wouldn't have thought this will really generate major income. Thank you.
Thank you. I just want to also say that we've got Isabel Apsley here. Ahmed, I don't know if you know this, but she runs a St. John Museum in Northern Ireland. And anyone, I know probably not in the near future, but anyone going to Northern Ireland in the future, please do consider going and visiting. She's got a little section on the eye hospital as well. I've never been, but I hope to one day. Isabel, you've got some calls for your contact details in the chat box. So if you could share that, because I think you've got some people interested in visiting you. So we've got a question from Carlo, from Vanessa Redgrave via Carlo Nero, her son. And if you just bear with me, I will find it. She asks, with the backlog of 80,000 patients, you have been obliged to reduce your payroll. This is very worrying, isn't it? Do you think we should concentrate on getting back the payroll?
Well, I mean, yes. I mean, I'm not too worried about the payroll savings that we have made, because this was made in March, April, and May. Basically, how did we manage that? Some of our staff, if not all of our staff, were giving a period of unpaid leave because there was no work at the hospital, and it wasn't really right to have people in the hospital during these difficult times. So yes, it was very hard to reduce payroll for our loyal staff, but the backlog of patients, there is about 80,000 patients that need service at the hospital. The reduction in the payroll that has taken place should not really reduce the capacity for the future, because that was really specifically targeting 2 months of pay or 3 months of pay. And many of our staff decided to stay at home because they felt, they don't want to take any infection back to their elderly, to their sort of parents. So yes, it was hard to make that decision. It was not a very popular decision, I can tell you this, but I think that really helped the hospital to sustain services during very difficult times. But with regards to the capacity, I think the hospital can deal with this backlog if it has the resources to do so. But it will not be a manpower. It will be more of a running cost and disposables, things like that, yes.
I've got a question.
Sure.
So my question is a little bit political, but it's hard not to talk about politics at all when discussing the region. It's about annexation. Sure. We've had a couple of questions coming in advance about it, specifically how it's affecting the hospital, how it might affect the hospital.
Yeah, I mean, annexation is something that nobody knows when it is going to happen and how much of annexation is going to happen. I personally think it will happen. I don't think it will happen at the same level that we thought to start with. It will be a smaller scale kind of annexation. Now, if we look at Jerusalem, I mean, Jerusalem was occupied in 1967, and we have been operating since then under Israeli jurisdictions, and we apply Israeli law, etc., here in labor law. So I'm not too worried about Jerusalem, because I think Jerusalem somehow has been officially and unofficially under Israeli control. Now the West Bank, if there's going to be some kind of violence, if annexation takes place, which I think it will, then depends really how the Palestinians and the Israelis are going to deal with that. I think there will be a period of violence. I think that will reduce the access of patients and staff to the hospital in Jerusalem. Now, where the hospital or the group, our group is situated, apart from the eye hospital, there are no annexation plans that are going to affect, for example, Hebron or Anapta. Gaza, of course, it's a different story. So the Anapta and the Hebron hospital, I don't think will be affected. They will not be affected because they are not part of any annexation plans. I am worried that a time will come when the Jerusalem Eye Hospital will be in Israel proper, whereby only Jerusalemites, I mean, I'm not saying this will happen tomorrow, but I think in a few years from now, this will be a possibility that the hospital will be operating in Jerusalem only for Jerusalemites. I hope this will not happen, but it is a possibility. So yes, it might affect the hospital, it might affect the staff, it might affect the patients. Depends really on the response of the Palestinian people, and of course also the security situation and the level of violence is going to bring. I hope it will not happen. The annexation will not take place, and I hope there will be no period of instability. But I have lived here long enough, and I know it will be. It will take place, and unfortunately, there will be some unfortunate incidents where people might even lose their lives. So, yeah, nobody knows, Diana. I'm sorry, except the Israeli Prime Minister.
Well, I don't think St. John Eye Hospital has ever operated under stable times, so must be getting the hang of this conflict situation. I want to ask what, well, we've got a question from David Verity that's just come in. What is the perceived risk in Gaza? David Verity, I don't know if you mean specifically.
As part of the annexation plan, I think. Well, to be honest, the Gaza special situation.
Oh, sorry, he means COVID risk.
Oh, COVID risk. Well, actually, I am now, I mean, I thought to start with that they were not doing enough testing in Gaza, and therefore the numbers were low. I have come to a different conclusion that Gaza has been under lockdown for the last 14 years. And I think this has helped them in a funny kind of way. Their only risk is people traveling from Egypt. There are many cases in Egypt, and the de facto government in Gaza, they're taking things very seriously. Everybody who travels from Egypt is locked is put in isolation quarantine for 14 days, and they are tested. There are so far 17 cases only, and our nurses and doctors believe these are true. This is a true picture of the situation. No patient, no staff for the last 3 months have been able to cross to Israel, and vice versa. It's not only the Israelis are preventing this, but also the Hamas government in Gaza is not allowing anybody, even patients, to come to Jerusalem, because they don't want these patients in, their perception is that they will come to Jerusalem or they go to the West Bank and they bring with them the COVID-19. So unfortunately, this is a bit unreasonable what they're doing, but it has helped them. It has helped them to reduce the numbers to only 17. We're talking about 2.1 million people in Gaza. And I think in the West Bank, there are about 3 million, 3.5 million. I suspect we have around 2,500 now. So Gaza I would say Gaza is safe, and Gaza has to be safe. If Gaza is not safe, believe me, it is a disaster. If there would be an outbreak of COVID-19 there, the healthcare system, and I think David, Mr. Verity knows the system there very well. It's a very weak system, and I don't think it will be able to cope with an influx of cases.
We've got a question from David again and one from Georgie asking about testing. Is there testing? Is there an antibody test in Gaza? And Georgie asks, is there a track and trace in place?
Testing, yes, is done. I mean, this is done through the World Health Organization. I don't think it's done at the scale that is really satisfactory. I heard that they do something like 100 and 120 tests a day, which is not really, which is very low. But I think if they continue closing the borders, I think that they will remain safe. But no, I don't think they're, I mean, in Israel, they're doing about 15,000 a day. In the West Bank, they're doing about 2,000-3,000. But in Gaza, I think they do less than 100. So out of that, they're getting zero. But I hope this is a true reflection on what they have there. Of course, anybody with signs and symptoms, they test them. This is what they say. But I don't think even they'll have the facility to test more than 100.
So I'm going to ask you the final question, Ahmed, if you don't mind, and then I'll hand over to Georgie for final statements. But so I wanted to ask, if people wanted to get involved in supporting St. John Eye Hospital, what can they do now? Is it donations you need? What is it you need?
Well, it's a very hard question and very easy question. I mean, I think for us, we rely very much on the support that we received from our supporters and friends around the world, and especially from the 9-10 priorities around the world, as you know. So, yeah, I mean, of course, this has really hit the hospital very hard in the sense of we have lost income, we have lost, patients' ability to reach this hospital has really affected also the morale of staff. I mean, if staff don't have enough work, that is a problem. But there is a good sign. In the month of June, we have treated more patients at the group, more patients than the same period of last year. So the demand is there, despite the fact that patients have some restrictions reaching the hospital. This month or last month, now we are on the 1st of July, I was looking at the statistics, we have treated more patients in Jerusalem, in Gaza, in Hebron, and we have performed more surgeries, I think about 7% more surgeries than the same period of last year. So the demand is there, we are dealing with the backlog, but of course, in this kind of financial situation, the support is very much needed. People can support us directly, can work with the guild, people can work with their own priorities, but we rely on the support of the local people as well as our international supporters worldwide.
Well, on that note, I will post, I've just posted the link to, if you have enjoyed and found this talk interesting, then please do consider giving us a donation. We find it very useful. I will thank you, Ahmed, and I'll pass you over to Georgie.
Thank you, Diana.
Thank you, and thank you, Diana, very much for running the Q&A. That was really good, really informative. Ahmed, that was a really, really good talk. I know it's late in the day for you, so thank you for staying up late for us. There's people from all over the world joining us today: New Zealand, Canada, America, South Africa, Northern Ireland, and we've got people in Norfolk, Yorkshire. I'm in Gloucestershire. So a huge thank you to everyone for joining us. This is going to be a regular feature for the Guild now, as we can't meet you face to face. We can't have events and gatherings and fundraisings together. So Diana's very kindly set up all the infrastructure for this. So it's a lovely way to keep in touch. It's a great way to share information and to all get together. So huge thank you for joining. Thank you again, Ahmed, and see you again next time.
Thank you, Georgie, and thank you, Diana, and see you. Everybody, of course. Thank you.